Good morning, Shaheen, Jessica, and Sarah. Thank you for that wonderful and thought-provoking panel. You've personally given me a lot to think about, and I hope to be able to incorporate many of the best practices you shared into how we do research here at the Financial Health Network. With that, I'd like to transition to our next session, Taking the Financial Health Pulse of 2021. My name is Thea Garon. I'm a Senior Director here at the Financial Health Network, and I lead the Financial Health Pulse Research Initiative. I'm joined by my colleague, Andrew Dunn, a manager here at the Financial Health Network and the primary author of this year's Trends Report.
Thanks, Thea. I'm excited to discuss the research.
I'm excited as well, particularly so because we find ourselves in such an interesting moment in time. On the one hand, there's a lot to be optimistic about. Personal saving rates are high, workers are being selective about their jobs, and Congress appears to be on the cusp of passing legislation that could really revolutionize the social safety net and provide a strong foundation for financial health for years to come. On the other hand, there are causes for concern. Relief and recovery measures have started to dry up. Eviction moratoriums and expanded unemployment benefits have largely expired. And other benefits, including the child tax credits, are at risk of being scaled down in the coming months. Plus, deep-seated financial health inequities remain across race, ethnicity, income, gender, and other dimensions. Our latest Financial Health Pulse Trends Report sheds light on some of these dynamics with new data collected earlier this year. Before I ask Andrew to share some of these insights with us today, I'd like to thank our funders and our partners. We are extremely grateful to the Citi Foundation, the primary sponsor of the Financial Health Pulse, as well as to the Principal Foundation, a supporting sponsor of the initiative. I'd also like to thank our research partners, the University of Southern California and Plaid, who have been with us since the inception of the initiative in 2018. So with that, let us go ahead and dive in. And Andrew, I'd like to begin by asking you, what did you personally find to be most surprising from this year's Trends Report?
Yeah, thanks, Thea. So the first thing that was a little surprising was that financial health increased again this year, putting the proportion of financially healthy people at the highest we've seen since we started measuring in 2018. So you can see that on that slide now, that our Pulse research shows that over a third of people in the United States are financially healthy in 2021. And at, kind of at first glance, the improvements might feel a little counterintuitive, but with a little more reflection and digging a little more into the data, they make a little more sense. We actually saw comparable increases between 2019 and 2020, just as the impacts of the COVID-19 pandemic were being felt in the US. So it makes sense that in another year of the pandemic, that with more government interventions, that the increases might continue. We also found that there were two big contributors to the changes in 2021. First, that what contributed to the changes were increased savings and a reduction in spending over the past year tied to the COVID-19 pandemic. Which, of course, contributes directly to financial health improvements, as well as government interventions in the form of things like stimulus payments, expanded unemployment insurance, things like that, which help people both improve their financial health over the past year and actually prevent their financial health from declining further. And it's also important to note that these improvements didn't just happen at the aggregate level. We see that first, for people with household income under $30,000, there were some slight financial health improvements over the past year. And then we also see improvements across race and ethnicity. So you'll see on this slide that the proportion of Asian American people considered financially healthy increased by 11 percentage points over the past year. The proportion of financially healthy Black people increased 9 percentage points, and there was a 4 percentage point increase for Latinx people as well. So those are big increases, and these results are powerful and show the impact that changes in personal financial behavior and government intervention can have on financial health in 1 year.
Absolutely. So there's clearly a lot to be excited about, but we also saw some trends in the data that were not so positive. So Andrew, what did you find to be most concerning from this year's Trends Report?
So I just spoke about how there were improvements across race ethnicity in the past year, and that's true, but just despite these increases, the gaps are actually still really large. So Black and Latinx individuals still trail white and Asian people in terms of financial health. We also saw that the gender gap in financial health increased over the past year. So the financial health of men improved while it stayed flat for women. And this is an area that's been pretty well researched, I think, over the past year, but it's still sobering to see that in our own data. Childcare, in particular, appears to be something that has disproportionately affected women during the pandemic. So women were more than twice as likely as men to not work at all due to childcare responsibilities in 2021. And as you can see on this slide, women whose work was disrupted by childcare were 45% more likely to experience financial stress due to the pandemic than those who didn't experience such a disruption. Likewise, women who were caregivers of an adult were also more likely to experience stress. And I think it's worth continuing to bring attention to these stats. The widening financial health gap between men and women reflects the disproportionate impact of the pandemic that's still ongoing now.
Absolutely. And I should note that we are in the midst of conducting some research funded by the Principal Foundation to explore these gender gaps that Andrew just highlighted further. And so that research will be released next summer. And we, again, expect to come back to many of these themes that Andrew just highlighted. So Andrew, moving on to the next question, up until this point, we've really been speaking about averages and aggregate figures. But we know that despite improvements at financial health at the national level, at the level of various subgroups, some people actually saw their financial health decline over the past year. So Andrew, can you tell us a little bit about which individuals were more likely to see their financial health decline over the past 12 months and why?
Yeah, so I think first, just that's a really good point that there's aggregate improvements, but that can really mask a lot of movement at a more granular level. So when we do that, we see that 43% of people experienced declines in their financial health, and 10% of people actually moved to a lower financial health tier, which means according to our financial health score methodology, they moved from being financially healthy to coping or vulnerable, or they moved from coping down into being financially vulnerable. We see that people with disabilities, low to moderate incomes, or less than a bachelor's degree were more likely to experience a decline in financial health. And we also found that employment disruptions were correlated with declines in financial health. So, obviously that's a lot of people had their employment disrupted during the pandemic. And we see that those who took time off from their job to tend to a serious illness in their household were more likely to experience a decline. And individuals who worked less, whether due to lower demand or reduced hours, were more likely to have a decline in their financial health than people whose working hours didn't change significantly.
Absolutely. And again, this just speaks to the importance of looking beyond those top line figures to understanding how different groups of people fared over the past year. I'll note here that this is a theme that we heard come up in our past sessions as well this morning, and I'm sure we'll come back to in the final session of today as well. So with that, let me go ahead and switch gears. Andrew, I'd like you to zoom out for a second. As part of our ongoing efforts to ensure that research here at the Financial Health Network embraces best practices around diversity, equity, and inclusion, we've made some key changes to how we collect, analyze, and share data. Andrew, you've really been leading these efforts for us. So I'm hoping you can very briefly speak to some of the recent changes that we've made in this regard.
Yeah, I could talk about this for a while. And I think it's important to note that this is against the backdrop of embedding DEI best practices in other aspects of our organization, including research. And really, it's about ensuring that we're following research best practices in both our Pulse research and, again, across the organization. So we've begun exploring this in the Pulse research, conducting new analyses, making sure we're framing and phrasing our reports correctly, exploring the type of research we conduct and how we do it. For example, in 2021, we added new questions on race and ethnicity, sexual orientation, gender identity, and ability, which allows us to understand financial health by new aspects of our respondents' identity. So we've included some of this analysis from these new questions in the 2021 Trends Report, namely financial health by ability and LGBTQ+ status, the high-level results from which you can see here. So just to talk through these results really briefly, first, looking at the two bars on the left side of your screen, We found that LGBTQ plus individuals are less likely to be financially healthy. So those are the blue segments at the top of the graph. And they're more likely to be financially vulnerable than people who are not LGBTQ plus. And again, those are the orange segments at the bottom of those graphs. And when we look at ability, which is the two bars on the right side of the screen, we also found that people with disabilities are less likely to be financially healthy and more likely to be financially vulnerable than people who do not have a disability. We explore these findings a little more in depth in our 2021 report than I can do here. And we're going to continue to conduct research on financial health by demographics and other aspects of identity. And I think importantly, how we can improve financial health, because I think that's a big part of it too. And so just to take a quick step back, we're, full disclosure, still implementing a lot of the research best practices and still have a lot to learn. We also have a lot to share about kind of our journey so far. Personally, if your organization is doing research on these topics, I'd love to connect and learn because I think it's really interesting.
Absolutely. I'll take this moment to just reiterate what Andrew just said. Our work here is far from done. We are really just at the beginning, and we'd like to invite all of you to join us on this journey as we work to ensure that our research practices are as equitable and inclusive as possible. So Andrew, I have one final question for you before we go ahead and wrap up this session. While it's impossible to predict the future, and even more so now amidst the ongoing uncertainty related to the pandemic, I'm going to go ahead and ask you to do just that. When we go back into the field with our next pulse survey in the spring, what trends do you expect to see from the data?
Well, I think Rob almost captured this sentiment at the very beginning, which is, and so I'm not going to quite answer directly, Thea, because the reason we conduct the research is to learn the state of financial health. So without doing that, I'm not going to get too over my skis, but I think it definitely depends on a couple of things. The economic recovery from the COVID-19 pandemic, for obvious reasons, I think, as well as the impact of the continuation and ending of a lot of government interventions. So things like stimulus payments, expanded unemployment insurance have ended in the past couple of months, whereas child tax credits have, are kind of top of mind right now as there's a lot of discussion about continuing them in 2022. So those changes for the past few months are really going to have potentially have a big impact on people's financial health. I think what's also important is to figure out how we can turn these relatively short-term financial health gains over the past year into long-term gains. So how can we really lock those in? How can we help people maintain the savings balances that some have built up, for example? And finally, I think it's just important to remember that the financial health gaps I discussed a couple minutes ago are still there, really need to be addressed and are still large. So that's something to continue to research and continue to examine.
Absolutely. And we have time for just about one or two audience questions. So Andrew, with that, let me turn to an audience question that we just received. Do we have any insights from our data into the impact of the new child tax credits that were launched in July?
Yeah, so we have kind of a new branch of research that we've called Pulse Points. We collect transactional data from a few hundred individuals that are able to look at financial health trends and changes in very close to near time. So we've actually begun digging into this data to look at child tax credits, which started in July. So there's been a few administered. Some really interesting results for people who experienced hardship previously, either affording food or affording healthcare. We see that when they receive child tax credits, that spending subsequently increases. So people who experience hardship are increasing their spending on food and healthcare, which I think is pretty positive results and shows that tax credits are being spent in ways that that people need the money.
Absolutely. And that research will be forthcoming really in just, I think, a few days. Is that right, Andrew?
I think a couple weeks, unfortunately, but pretty soon.
Perfect. Great. Then let's go to one more audience question. And this is a fairly foundational one that we breezed over in this conversation. But the question is, Andrew, how do we go ahead and measure financial health in this research and across the organization?
So we have a methodology called the Financial Health Score, which you can read a lot more on our website than I can explain right here. But we basically ask 8 questions that are indicators of financial health and compose an aggregate financial health score that's indicative of how people are spending, saving, borrowing, and planning. And then people who do well on those components are considered financially healthy. People in the middle are coping, and people who are struggling in several different aspects of financial health are considered financially vulnerable. Again, that's on our website, and you can read a lot more about the score and its methodology there.
As well as in the appendix of the trends report we just released. Fantastic. So with that, I see we are at time for this session. So I'd like to go ahead and wrap up by inviting all of you to read the Pulse report. The link should be available in the chat box for this conversation. And if anybody has any other questions that we didn't get a chance to answer at this session, I really do want to take this moment to invite you to continue the conversation with us after this session, to ask questions, to share feedback, and to keep the dialogue going. With that, thank you so much for your attention this afternoon.